Today we'll be talking about bed mobility and transfers, how to keep the patient and yourself safe. And here we go.
There you go, babe.
First, we're going to start with some basics. Number one, your center of gravity is going to be S1, S2. Now, whatever object you're holding, you want to pull in close to you. Next, we have our wide base of support. You see how my feet are spread enough to give me that wide, almost staggered like a football player stance. Our next thing we're going to use is a gait belt. Now when you're lifting, you want to make sure that you have a lordotic back. So you want to have that curvature of your back when you're lifting something up. And remember, no twisting, and take small steps to turn. Most injuries with your back happen when you're lifting and twisting at the same time. We want to prevent that for you.
Alright, now that we've gone over the basics, we're going to go over how to prevent falls. So first and foremost, you always want to follow protocol, whatever's on the chart, especially the assist level during transfers, whether they're a min assist, a mod assist, or a max assist. Also, when you're using the gait belt, use an undergrip. And if they start feeling a little wobbly, they're not feeling good, always get closer into and help them a little bit more. But before you start a transfer, I'm going to back up a little bit. We always got to make sure that we have clear pathways. Make sure anything that they might be hooked up to, whether it's catheters, IVs, are cleared. They're not going to yank. Make sure the sheets are out of the way, railings, any chairs, just anything that could prevent them from falling or tripping.
Now,
First transfer we're going to illustrate is bed mobility. Simply having the patient be able to slide up and down in bed. The way that we do that, number one, is we want to make sure the patient is high enough that if we need to assist, we're not going to be hurting our backs. So we're going to raise the bed to a comfortable level for ourselves. Next, we have the patient go ahead and bend their knees and rest their feet on the bed. This way, if we need them to slide up, they can push up with their elbows and go ahead and slide for us. Show us how you can do that. There we go. And the same thing if they need to scoot down. They can use that same principle, perform a bridge by lifting their pelvis and slide themselves back down. Now most hospital beds are going to have the option where you can either raise the foot or the head of the bed. This is going to help you out because you're using gravity to assist the patient move to where they need to go. Okay. Now we're going to continue with our bed mobility. Instead of just having the patient move up and down in bed, we're going to have her scoot from side to side. Her knees are already bent, and all she needs to do is to bridge again by picking up her pelvis, sliding it over to that side, and then she can move her chest, her upper body over, and then we can move her legs over as well too. Same thing for this way. Now this is perfect because now we can roll her over onto her side, what we call log rolling. She'll move her hand over this way, her knees are already up, she can turn right over. And right there, that was about mid to bod assist.
you're recording.
Now we have our patient already turned on the side. This next transfer or next bed mobility we're going to do is them laying from the side to sitting up. What I'm going to do is I'm going to pull her legs over the side so that we have gravity assisting us as she sits up. I'm going to reach underneath her neck and go ahead and help her to sit up. What she did when she was sitting up, she pushed up with her elbow. Not all the time will the patient be able to do that, but when they can, you want to instruct them to go ahead with that. Now, because I have the bed up higher, her feet are not touching the ground, I have to make sure that I stay close so that we don't create a fall risk here. Alright, and we want to make sure the bed is lower to the ground where the patient can actually touch the ground. Now, if their legs are still dangling, we can have them scoot to the edge of the bed. So go ahead and scoot to the edge of the bed. There you go. Now she is stable, she's secure, and she's safe.
I'm ready.
Alright, so now that we've got them sitting on the bed, we're going to do a sit to stand and then a pivot transfer. So, very important that we remember our gait belt. I'm just going to put this around you just in case something happens. I can hold on to you easy. Yep. And I got to put it on pretty tight, okay?
All right.
Okay, so now that we have the gait belt on, what I'll ask him to do first is scoot to the edge. Then I'll be staggered feet, keeping my back straight, bending at the knees, keep them close to help him lift up. Now we also want to tell him to lean forward, get his nose over his toes before we stand. When we go to pivot, we want to pick up our feet instead of twisting to sit down. So now I'll show you. Okay, can you scoot to the edge for me? Good. Now using your hands on the count of 3, we're going to rock forward and you're going to push up, stand up, okay? Alright. I'm going to get a little close. Ready? 1, 2, 3. Good. How are you feeling?
Dizzy.
Alright. And now we're going to turn. Walk your feet. Good. Feel through the wheelchair. Make sure you and that's it. Alright. Now we're going to go over that same transfer we just did, but with an assistive device, such as a cane, a walker. What you want to do is you want to have it fairly close. You want to encourage them to again scoot to the edge for me. You're going to use your hands, lean, nose over toe, push off, and reach for the walker, one at a time. Go ahead, push off, reach, stand up. Okay, now using the walker, you're going to pick it up and take your steps. Walk back until you feel the wheelchair touch the back of your legs, and then reach for the handles of the wheelchair. Also, for the wheelchair, you want to make sure that it's locked, which we did prior to the transfer.
Okay. This transfer we're going to be talking about is one I hope you don't have to encounter too often, but you will encounter at some point in your career. What is transferring the patient from the floor after they have fallen. First, you want to perform all necessary checks, vitals, questionnaires, make sure that the patient is okay, no broken bones or anything like that. Next, we're going to instruct the patient to go ahead and to roll on her side. Now, I want you to go ahead, reach over, and roll on your side. There we go. And then, after that, we're going to place a chair in front of her so that she can get in the crawling position, then the kneeling position. Go ahead and lay on your stomach. Get in the crawling position or the quadruped position. Put your hands up there. That's good. Now she's in the kneeling position. She's going to rise and be able to sit in the chair now.